when we say something is or is not, I don't want to get too heady here, but I want to kind of abstract from that. And instead of saying something is, which philosophers call an ontological status of something, I want to make it a little more abstract and just say, let's apply a conceptual model. That way it's not is or is not. And so what I'm going to say, well, let's apply the conceptual model of disease. And the next question is why? Well, here's why. Because can I get outcome data? Will it make me be able to predict a course of something? Can I intervene with pharmacological or psychosocial intervention to get outcome data? So that means, okay, so you have the disease of hypertension. Let me give you this pill. The blood pressure should go down. I'm putting it very simply. Does it go down? Yes. So having high blood pressure is pathophysiological, is pathological. I'm going to give you this medication to make it normal physiology. Yes. So what we're going to do is apply the conceptual model of disease. Now, you could say, hey, that guy has diabetes. That's easy. I can pick out all of these markers, physiological markers that are off, and I can give certain things and it fixes them, and that's all it is. Here's the problem, and here's what people are missing. Actually, guys that do this understand this. All diseases are a function of the environment you're in, even things you don't think are so. And let me give you that example of diabetes. If I have a whole bunch of, let's say, a certain group of Native Alaskans or Native Americans that grew up in a certain environment and they've been living there for 1,000 years and they've been healthy as can be. Now I take that group of people and move them into, let's say, modern society or a different continent, different environment. All of a sudden, all of those people are suffering from hypertension, diabetes, heart disease. That clues you in that a disease is not just a disorder of structure or function in a human being or an animal or a plant without any external influence. So the point I'm trying to make here is all diseases are a function of not just your internal genetics and physiology and biology, but the environment that you are in. That's why we have public health research to see, why are these guys getting this cancer? Well, you put them in this environment and there's all this toxins and they get this cancer. Keep that in mind. Now we take it to something like addiction. Well, this is also a disease because we do have a lot of physiological secondary markers, which is MRIs, functional PET scans, some genetic data that tells us this is a disease. But it's a very complex disease because unlike something like, let's say, a cancer where you put them next to this factory and they all get cancer, it has a very rich and complex psychosocial influence that makes this disease worse, better, or even happen. So that's why there's a complexity to it. And I know for a fact that I change those environmental influences, and or if I give a medication, I can predict the outcome of that disease in a population. That's why we need to, it's not a disease. We can, instead of saying that, I like to say we can apply the disease model to addiction as a chronic disease that has relapsing, remitting course that we aim for absolute remission. And the environment has a very complex influence on it. And it's so complex and it's wrapped up in so many biases that have to do with our cultural backgrounds, whether it's religious background, whether it's politics, whether it's public policy, that it imposes the idea of, hey, that's your fault, it's your responsibility, it's your choice. Remember, things like schizophrenia, bipolar disorder, there was a time you might be put in prison for that. There was a time you might be burned at the stake for something like that. Today, it is a disease, and there's an advocacy of mental health for compassionate, benign, clinical care to get these people to where they want to. Now bring that to addiction. Are we not doing the same thing? People are being ostracized. They're being marginalized. They're going in prison by loads. If you look at the 90s drug laws, when it started incarcerating with the heavy incarceration for nonviolent drug crimes, isn't this the same thing? I have psychosocial factors that I can point to that can make your life better. I have pharmacotherapy that I can point to that can make your life better. And I can tell you, there's no addict once they've gotten to the severe points of their addiction that tells you, I like this. I choose this. I want to do this.